Okay, good morning and selamat pagi. So welcome to not a medical podcast, but it's about health. The show where we skip the medical jargons and we get straight to health and living well itself. So my name is Dr. Rama and I'll be the host for today's episode, titled Tuberculosis, Should We Be Concerned? So this podcast is proudly brought to you by the Department of Social and Preventive Medicine from the Faculty of Medicine, University Malaya. So let's dive into today's episode itself. So we'll be discussing mainly on tuberculosis disease. I think as everyone knows, tuberculosis has been here for a long period of time. It's been a global issue and a local issue as well. We've worked towards eliminating TB, but it has always been in our country as well. So today we are going to discuss about the disease from both the clinical and public health perspective. To inform everyone regarding the background about the disease, what to look out for, and what you can take steps to actually prevent from getting infected itself. So we have two experts today with us. So our first expert here with us is Associate Prof. Dr. Wong Chi Kwan. So he's a respiratory physician from the Division of Respiratory Medicine, Department of Medicine, University Malaya and University Malaya Medical Center. And we also have Prof. Dr. Mas Ayu. So Prof. Mas is an epidemiologist and a public health medicine specialist. She's also heading the Department of Public Health under University of Malaya Medical Center, and she's from the Department of Social and Preventive Medicine as well. So let's dive into today's session. So maybe to start off first, how are you all?
Yeah, I'm good. How are you?
I'm fine as well. So thank you for attending today's session, Prof. Mas.
Yes,
are you good as
thank
well?
Thank you for inviting me. Thanks.
Okay, all right. So maybe let's dive into today's session directly, and if we can get a little background about the disease first. So maybe Prof. Wong, would you like to share a little bit on what is TB actually? What is TB all about?
Yes, TB is actually a lung infection, all right? Or it's the commonest lung infection. It has been in the so-called known for decades, all right? It's caused by a germ named Mycobacterium tuberculosis. And patients have this lung infection is a bit different from other acute infection, for instance, normal pneumonia. This bacteria is special because it's slow growing. It can actually infect your body and it's slowly growing and causing the symptom in a very slow and long-standing and it actually can cause a lot of damage to your lung. So the commonest presentation for this disease is basically in the lung. But of course, it will also go to the bloodstream. It can go to other organs as well. So the patient can have other form of disease like the brain infection, the spine infection, as well as the gut infection. So this is a very difficult to sort of like catch infection when this is early. But most of the time, because of the poor awareness, patients do not know that the infection is in their body. So they only present it to us very late. So this is a very sort of like long-standing chronic condition. Yeah.
Okay. And so, Prof. Wong, just to clarify as well, so previously, I think during the COVID times and so on, right, we've always been heard about COVID virus and all. So is this TB a virus, a bacteria? What type of infection is this?
Yes. So there is a form of germ, and this germ is the bacteria. All right. It's a special name. It's called Mycobacterium. Okay. This is a family of a germ, and this germ is basically sort of like spread through the air, all right? So you can actually catch the infection via airborne, all right? And of course, it doesn't look like virus because virus usually it's actually quite fast, duplicate very fast, and the infection is quite acute. But for TB, it's grow very slowly. It's only grow one germ in a day. So hence, you don't get the symptoms immediately. You catch the infection. If you have a very good immune system, the infection is being eliminated. But of course, if you catch an infection and you can't actually eliminate the infection, it will be very slow growing and the symptoms may only present maybe 2 to 3 months later. Right.
I see. Okay, thank you, Prof. Wong. So just to pick up on that as well. So I think in recent times we've heard
Yeah.
a lot of use of this term latent TB or TB pendam by the Ministry of Health and so on, right? So is it what you mean? Are you talking about latent TB as well because it takes a longer time and so on?
Yep. When you have a TB infection, so the germ actually stays in your body. It doesn't cause any infection. It doesn't cause any symptoms yet. So it's just basically hidden in your body, anywhere in your body. It can be hidden in the lung or in the lymph nodes. Lymph nodes is a place whereby usually our body tends to eliminate all this infection. So, but the germ is very tricky. It's very very smart. It just stays in the body, and it stays for a long period of time. It can stay in your body for years before it's being activated or erupted. So this is a term called latent TB, meaning the patient doesn't have any symptoms. When you do X-ray, you don't see any changes in the X-ray. So this is what we call TB pendam or latent TB. But when your immune system become low, or when you get older, so you have this germ reactivate or erupted in your body. It will cause symptoms such as coughing, and you can cough up blood, and you can have fever as well, and you have weight loss, poor appetite, things like that. So that will you'll be termed as having an active TB.
I see. All right. And so an interesting fact is you mentioned about activation of the infection itself. So what actually are the factors that maybe can affect and cause us to get this activation phase and move us into an active TB with the symptoms that you just shared as well?
Yeah. There are few populations that are prone to get reactivation of the TB. So first of all, their immune system, the host themselves, the immune system is low. All right. What are the conditions that you have a low immune system? So if you are on medication, for instance, if you are a patient with a cancer and then you need to be treated with chemotherapy, you have low immune system. If you are having an immune problem and you need medication such as steroid to treat the condition, it can actually bring down your immune system as well. If you have a condition called HIV, right? HIV, which is a virus that causes low immune system in the body, and you have a higher risk of developing TB as well. Same goes with patients with abnormal lung problem. For instance, they have a respiratory disease like chronic obstructive pulmonary disease. They are smokers, and this actually increase their risk of getting TB as well. So there are many more conditions, including healthcare workers, whereby we have a higher risk of exposure to TB patients. We also tend to have a higher risk of developing TB when we get older. So as we age, our immune system will drop as well. So this actually increases the risk of developing active TB at the older age.
All right. Okay. Thank you, Prof. Wong. So moving on to Prof. Mas, maybe. So we've got a overview of what TB is generally, about the disease and so on. So in recent times, I think in recent weeks, there have been a lot of information from the social media and discussion about a lot of clusters, about outbreaks that's happening in Malaysia, TB outbreaks specifically. So maybe Prof. Mas, could you just share and tell us, like, should we be concerned? Like, what's the current situation like in Malaysia itself?
Okay, let me share with you the current situation. As of February 2026, Malaysia have managed to detect 10 new clusters across the 7 states. So the one that actually with the highest number of cases is the Kota Tinggi outbreak, where it's centered in Johor. It's originated with from a 72-year-old religious teacher who is in that case, and is spread to 37 individuals, which including 29 children Okay. As for states distribution, Selangor has the highest cluster, 4 clusters so far this year. And Johor has the highest number of cluster within a single, highest number of cases from a single cluster. So other states that have a cluster of TB are Kedah, Kelantan, Pahang, Perlis and Sabah.
I see. Okay. And Prof. Mas, if I may just ask, so maybe for our viewers, like what is this cluster? What does it mean actually by clusters?
Okay, clusters means you have in that case, and then is spread to the to the one that close contact with you. So for example, in Kota Tinggi outbreaks, the total number of people, the contact tracing is 903 people. So you can
That's
see
a lot
that,
of people.
yes, that's a lot of people for this cluster.
Okay, so meaning these 903 people were basically somewhat in contact with each other at some point lah.
Yes.
And so how can they come in contact? Is it like from common areas, or like is there a specific place where they collectively attended a function, or there was some place where it was crowded areas or something like how, what caused it actually?
Commonly, they are together in a crowded place. For example, typical example is you are in prison, in pusat tahanan, where you being together all the time. Okay. But nevertheless, for Kota Tinggi cluster, the students actually being in the long hours with their teacher. So even with that also, you're talking about if you're not in prison or pusat tahanan, as long as you are in the environment, it could be another factor is poor ventilation, but a long contact hours could be one of the main reason.
I see. All right. And if I may just ask as well, maybe Prof. Ong can also chip in as well. So in terms of transmission, right? So we talk about transmission of diseases. So how is TB actually transmitted?
Yeah, it's airborne transmission. All right. So like TB is a very small germ. It's 1 to 5 micron, and human is the only reservoir, meaning it's only infect the human being. So human being transmission to another human being. And of course, the patients, when they have this a lot of germ inside their airways, when they cough, when they sing, when they even talk or sneeze, and if you are within the 3 meter vicinity, so you have the high chance of catching the infection. All right, particularly when you are in a very crowded room, as what Prof. Mas mentioned, and when there's a poor ventilation in that room as well. So this actually increases the risk of transmission of the disease to another person.
Okay, if I may add, I think public always worried beside the airborne, it could be due to other mode of transmission or not. I would like to emphasize this is not a surface based, meaning that if you are shaking hands or sharing toilets with other people, it's highly unlikely for you to get TB. So it's very important to have awareness, not to over panic. You must really know the mode of transmission.
Yes, totally agree with that. So airborne is the main route of transmission, and definitely you also need to look at the index case. If let's say the index case has a very high burden of disease, meaning they are having a positive smear. This is a test that usually we do for patient with TB, and we smear the sputum of the phlegm, and it turns out to be positive. It means that this patient is high likely to have a lot of germ and has a high potential to transmit the disease to other people. The second thing is, let's say the index case X-ray is very horrible. The lung damage is very horrible. There's a lot of cavities or lubang-lubang, what we say, lubang-lubang, dekat itu paru-paru. And this actually increase the risk of transmission to other people as well. So it depends on how much of the germ load inside the index case. The higher Of course, the person who actually received the germ, it also important because when they have low immune system, they are having a higher risk of getting the infection as well. So immunity is very important for a person to defend the infection. If let's say you have all this low immunity, as what I mentioned earlier, you are having a higher tendency of developing the disease itself.
Okay, thank you. So, if looking at this, right, there are many factors actually that can affect. One is your environment. Another thing is your individual factors as well, your characteristics, like what Propong mentioned, their immune system. Do they have any underlying diseases that may put them at higher risk as well? And so, what can the public actually do to prevent themselves from getting infected? I remember I hear you saying a lot about immunity, and also I think that is like a very important part to ensure that your immunity is well and your well-being is also good. You're not sick. And how about smokers?
Okay, definitely smoker has a higher risk because when you smoke, it actually causes damage to the airway. It causes increase in all this mucus accumulation in the airway as well. And your airway cannot effectively clear off the infection. So when you have this TB germ infected into your airway, they are difficult to be eliminated from your body. So it will just stays inside your airways as well to your in your lung, and then causing infection following that. So smoking is notorious, and then it can damage the airway, and definitely studies have shown that it's increased the risk of a TB infection.
I see. Okay. And I think just want to bring us back as well. So there was a lot of discussion earlier. You mentioned some of the symptoms that can be experienced by people who are infected with TB. You have night sweats, you may have fever and chills, you may have loss of weight, loss of appetite. Yes. And so what are the screening methods that are available for people if, say, they were to have some of those symptoms? Where should they go to get tested, and what are the available tests that are being conducted?
Yeah. We are very blessed because we stay in Malaysia, and in Malaysia we have a very good health system. So whoever who actually have any kind of these TB symptoms or chronic symptoms that they do not know whether they have TB or not, they can go to any healthcare facilities, whether it is government or private facilities. So the first thing that the doctor will do will, of course, interview the patient and also ask about all these important symptoms, whether they have all these symptoms, and secondly, whether they have any recent exposure to anyone who being diagnosed to have TB, because those close contact patients are highly possible to develop active TB within the next 2 years. So if they have all these risks as well as poor immunity, all this has to be interviewed by the doctor. Following that, we will do certain screening tests. Of course, we examine the patient. We look for any important signs. But if let's say there's no important signs of TB, then we'll actually get an X-ray. X-ray is a very, very sensitive tool to detect whether the patient has any lung changes, lung infection, okay, particularly over upper part of the lung. Why is it so? Because TB germ or mycobacterium likes air, likes oxygen. Okay, so therefore, where they will actually stay at the top of the lung because that part of the area is well aerated and there's a lot of oxygen. So there will be some form of like infection changes as well as damage over the upper part of the lung. These are classical changes for TB in the X-ray. Furthermore, we need to actually examine their phlegm or their sputum, okay? And this sputum test is very, very important to see whether we can identify the germ under the microscope, or we call it a smear, all right? Direct smear. If let's say we couldn't identify that germ under the microscope, then we have to culture it. So culture meaning we grow the germ. Because as what I mentioned earlier, it's a very slow growing germ. It takes a while to grow it. It can go up to 2 weeks, up to 8 weeks to grow the germ. because of that slow process, that's another faster way of detecting the TB. We call it gene expert test or a PCR testing. PCR testing is looking at the genetic material of the TB in the sputum itself, and that is very quick. But it's an expensive test, and it's not widely available in all the healthcare facilities.
Is it like a blood test or a
No, it's a sputum test.
I see.
It's a sputum
Right.
test.
Okay.
So all these tests will actually tell us whether the patient has the active pulmonary TB or the lung TB of the lung. All right. Yeah.
Okay.
So this is for the active TB screening.
Active TB screening itself. Okay. And so when people, maybe I can ask Prof. Mas as well. So regarding the screening and testing methods and all, for the general public, what are the avenues that they can go to actually to get screened in case they are having any symptoms or such?
Okay, first of all, they must aware that any cough, there's a 2 weeks rule, we call it. So if you have cough more than 14 days, okay, please see a doctor. It can be either the private doctors from the clinics or from the government. As what Prof. Ong mentioned, a proper history taking and physical medical examination will be conducted. And if it's needed, a chest x-ray, they will refer the patient for a chest x-ray. Okay, so that can be done. Even though, let's say you just go to private clinic, even though there is no x-ray facilities, I think the doctors will refer the patient to any facilities with the x-ray, that the x-ray can be done.
All right. So basically, if the public have any types of symptoms, they can just walk into any healthcare facility. If those screening or diagnostic tests are not available, and then they'll be referred to a facility which is suitable to actually
Yes.
get tested and all. And eventually, they will be managed accordingly. Right. So maybe just to talk about this disease, right? So if someone is tested positive they have been diagnosed, okay, the doctor says, okay, sorry Encik ada TB sekarang, active TB. What is the next step? Can it be treated, or is this disease permanent? How do we go about it?
The disease can be treated and it can be cured.
Oh,
Right.
okay. So that's a good thing.
Yeah. But the treatment is kind of like long course. Okay. It can be like up to 6 months. Okay.
Okay.
So the minimum treatment duration will be 6 months. If let's say your disease is serious or severe form of a TB, for instance, is involving the brain or the spine or some other organ, you may actually be treated for as long as 9 months to 1 year. But generally, for pulmonary TB or the TB of the lung, 6 months of treatment will be sufficient to actually eliminate the infection, and you can be cured from the disease as well. But the problem is you need to take many tablets.
Many tablets.
Okay, many tablets, long duration of treatment. That is the challenging of managing TB. And the other more challenging issue is regarding the side effect of the medication. Because there are more medication, you tend to develop certain side effect out of the anti-TB medications.
I see.
Okay, if I may add,
Yes,
actually,
of
we would like to ensure compliance, and we aim to prevent the drug-resistant TB. That is, I would say, a disaster if it's happened.
Yeah.
So, in order to ensure compliance, we have this program or service that we call it DOTS. So it's directly observed treatment, where patient come to the hospital, the healthcare workers will give the medication and ensure patient is swallowed. If patient have good compliance with a good support from family members, a trained family members also can do that. So meaning that patient does not require to come daily to the healthcare facilities. So that is something that we have to ensure patient is compliance.
Yes, definitely. I totally agree, because lack of compliance will cause emergence of the drug-resistant TB, and drug-resistant TB management will be even more complex, and the side effect of the medication can be more toxic, as well as the duration of treatment can be longer, and the cost of treatment will be more expensive as compared to the normal TB.
See, so what I gather is, so the good news is this disease can be treated. The bad news is the duration of treatment. I didn't know that you need to be treated for 6 to 9 months. That's like a really long period for someone to get treated with that. And secondly, there's also an issue that you may develop drug resistance TB itself. So meaning drug resistance, meaning that if you just could share with the public. So drug resistance is basically, is it that the medication is unable to kill the germ, or?
Yes. For the first line TB, meaning the one that is the drug susceptible TB, we usually give 4 important TB medications. If I can say out, the name of the medication is isoniazid, rifampicin, ethambutol, and pyrazinamide. So for drug-resistant TB, if you can understand, there are 2 of the medication which is the backbone of the treatment of the TB, meaning isoniazid and rifampicin, is not effective to actually kill the germ. So if you have this resistance towards the 2 anti-TB drugs, you will call your having drug-resistant TB, right? And if you develop this multi-drug resistant TB, you need to be treated with a longer period of time, second line of a TB medication, which is more toxic, more expensive.
I see. Okay. And if you could just share, Prof. Wong, like what are the common side effects that you see among TB patients who are on anti-TB medication?
Okay, first of all, these TB medications are mainly metabolized by the liver. So definitely liver is a very important organ when we're managing patient with TB infection. We must make sure that the liver is healthy to metabolize the medication. For patients who actually have underlying liver disease, or they are alcoholics, and they have a hepatitis B infection, they're prone to get this liver damage when they are on this TB medication because they can't really metabolize the medication effectively. Certain patients also has the high risk of developing this liver toxicity when they are on TB medication, because sometimes they also take some other medications that can actually make the TB interaction, TB anti-TB medication interactions.
So these medications basically can interact and have an effect with their existing medications as
Yes,
well?
yes.
Okay.
This is kind of complex to actually explain it now, but the TB medication can cause a lot of interaction with other medication as well. So we have to be very careful. There's a lot of drug-drug interactions, and certainly we must make sure that we monitor the liver function following the TB treatment. Usually 2 weeks following the TB treatment, we will check the liver function and make sure that the patient liver is okay. But we also emphasize to the patient whenever they have any symptoms, for instance, they have a tummy upset, they feel nauseated, they have poor appetite, and they're vomiting away when they are taking the TB medication. These are actually red flag signs that they are developing some sort of like a severe form of a adverse event towards the TB medication. And the more serious one is when you are looking at the mirror and you notice that your eye is yellow. That is even the more significant red flag sign that telling you that your liver is not functioning well. Yep. So the liver is a very, very important organ when we manage TB medication treatment. Yeah. So the other side effects might be more important is on the eyesight, because one of the drug called ethambutol can actually cause eye toxicity. So the nerve of the eye has to be sort of like examined. So we do visual testing. We make sure the patient's visions are all right following the TB treatment, and our doctors will actually refer them to have a proper visual assessment before and after the treatment. So certainly other things like numbness of the fingers, all these are more prone in patients with diabetes, kidney failure patients. So therefore, we will actually give them a higher strength of a vitamin B6 to prevent all these unnecessary complications. And there are more, but I do not want to scare off everyone. But these are the main things that we look for when we start the patient on TB medication.
All right. Okay. Yeah. So the good thing is it can be cured, but it also comes at a cost at times.
Yep.
And so the other thing is, so we've always heard about like previously with certain diseases, there are vaccines available to also prevent those diseases. Are there any vaccines available for TB?
Unfortunately, there's no new TB vaccine that's available currently that is being used in the market to prevent TB infection. Whatever we have is just BCG. So we had our BCG when we were born, and maybe if let's say you do not have a scar, you have to have a repeated BCG vaccination at the age of 12. So that is basically to prevent someone from getting a serious form of TB infection, but it cannot prevent us from getting pulmonary TB, the lung TB of the lung. You can't really prevent it, but it can just reduce the severity of the TB, like preventing you from getting dissemination of the TB of the brain and as well as the spine. Yeah, particularly protecting the younger population.
Younger generation. Okay, all right. And just to follow up on this, so basically we see that although TB can be treated, the duration of treatment is long. There are a lot of potential side effects from the medication, even if you get treated. So looking at this, I think prevention is much better than cure itself, especially for TB. And as what Prof. Mas mentioned earlier, even with the compliance towards TB medication, and patients have to come every day, take the medication. It's not easy as getting treated like other diseases. Probably it's much more complicated. And so maybe Prof. Mas, could you share like what can the general public do to actually, what is their general preventive measures that they can take to protect themselves from actually being infected with TB itself?
If you happen in the crowd in the enclosed space, okay, if you can actually ask permission, okay, do provide a good ventilation by open the windows. The sunlight will definitely kill the bacteria, and the natural airflow can actually disperse the bacteria. So in principle, ventilation. Second one is cough etiquette. I think everyone should know if you're coughing, close actually, when you're having cough, do actually cough into the elbow, not by hand. Okay. Good hand hygiene, hand washing, and also using the hand sanitizer. Okay, I think we everyone has actually experienced wearing face masks. So carry a face mask everywhere when you're actually noticing that the crowd actually have people coughing. And if that people coughing is actually not wearing face masks, you can bring extra face masks by offering that face mask to the person who is coughing. I think people are actually quite being acceptance in such a way that when you cough, please wear a face mask. Okay. So as for now, that will be the basic prevention strategies that you can do.
Right. And I think what Prof. Mas mentioned about the mask and all, I think COVID taught us a very good lesson. In fact, nowadays when we go to public areas as well, crowded areas, I still see people wearing masks, and I think we've just grown comfortable with wearing a mask itself. And I think that's a good thing as well. So another worrying thing, maybe Prof. Mas, like Raya is just around the corner as well. And then now people are in a panic or sort with like a lot of outbreaks of TB and so on. So should the public be actually panicked about this? I mean, what was the situation like in previous years? Are we in like an increase? Is this a surge that we're currently seeing, or is this the usual numbers that we are seeing?
Okay. First of all, do not panic. So, whatever information being given by the governments or by the authorized agency, you shouldn't ignore. Okay. So, what being observed in when we compare the statistic in 2026 and 2025, definitely in 2026 you can see 10% increase of cases. So in 2026, by week 6, which is mid-February, there are already 3,161 cases. Whereas if you compare during 2025, during the same period, we only have 2,342 cases. But just would like to share the current trend. We can see that you can see the cases is going down. So I think the public health have done a very good job in doing the active case finding, and another good news to share to highlight is the number of people died is actually still manageable. It's not increasing, meaning that we detect or diagnose them early, treat them early, prevent them from having complications.
All right. So I think that's an important thing. So I think if anyone has symptoms, the key thing is to go and get screened and tested early so that there's early detection, and then we can prevent complication, and like what Prof. Wong mentioned as well, prevent the severe forms of TB as well, like disseminated TB and so on. I think that's like a very good discussion that we had about TB general and diseases, the TB disease in general itself, the clinical aspect as what Prof. Wong has mentioned, and the public health perspective from Prof. Mas Ayu itself. I think before we actually end today's session, firstly, I'd like to thank both of you for today's session. But maybe before we end it, just one last key message to our viewers before we end the session. Maybe we start with Prof. Wong first.
Right. So I guess if you are a close contact of a TB patient, do not worry. You just need to screen yourself. Screen whether you have this active TB or latent TB. So if you don't have symptoms and your test, your skin test and your blood test turns out to be positive, and the doctor telling you that you have a latent TB and suggests to start preventive treatment, if you do not have any high risk of developing side effect of the TB medication, by all means, treat yourself. Prevent yourself from getting an active TB. All right, because the treatment can actually prevent a 90% of a chance of you developing active TB in the later years. So don't be scared. The TB infection can be cured, but you just need to come and seek treatment early. The earlier is the better.
Thank you, Prof. Wong, for that message. Maybe Prof. Mas, any messages from a public health perspective, especially with Raya around the corner, to our listeners as well?
Of course, during Hari Raya, we are meeting family members and friends. Sometimes during the open house, the place is a bit crowded. You can't actually simply open the windows if that's being hosted by other people and is air conditioned. But what you can actually do is protect yourself first. Wear a face mask. I think it's quite acceptable. Going to the open house and wear the face mask. And you ever see other people is coughing, do offer face mask to them.
Okay. Thank you very much, Prof. Mas. So I think that was a good summary of today's discussion in our podcast today. Thank you to both of you for sharing this with our viewers, and also thank you to our viewers for actually joining us today on this podcast. Not a medical podcast, but it is about health itself. So if you found these insights useful, please share the love with your family and friends so we can all grow healthier together. And remember, kita jaga community. Don't forget to hit and subscribe button to stay in the loop, and see you in the next episode.